Telehealth. It's a way to access healthcare from just about anywhere.
I still feel like I'm getting that face-to-face conversation with my doctor, but I can do it from my home.
You can see your family doctor or a specialist over your phone, over your email, or over your computer screen. And it's easier to use than you may think.
I had a patient the other day who's 89, maybe almost 90, who does video visits just fine and is quite technologically savvy. So I think that's a misconception, is that most people think that they can't do it when indeed they can.
A Connected Nation Michigan study recently examined telehealth in 5 rural Michigan counties. It found nearly 2 out of 3 patients said their healthcare providers offered some form of telehealth even before the pandemic through an online portal, website, or mobile app.
It is a real game changer for how we're going to be able to deliver care and really help the patient do better.
A virtual visit means a patient can see providers, even in areas with few to no hospitals.
People in the rural areas don't have as much access to the doctors, the hospitals, the clinics, as much as maybe in the urban areas.
It allows individuals not to have to take a full day off of work, and we're able to see a specialist that may not have always been in our area because we're now bringing it in virtually.
That includes specialty services as well as diabetes education, physical therapy, occupational therapy, and speech therapy.
The study also found that telehealth usage, on average, leads to nearly 5 fewer trips to the doctor every year.
On a good day, we generally have about 14 visits a day. Sometimes it's a little bit more, sometimes it's a little bit less. We do a combination of video visits and telephone visits.
And in the 5 counties surveyed, it was estimated that telehealth would mean a savings of nearly $6 million per year.
It'll further reduce the costs, eliminate time wasting, and save a lot of money at the same time.
That includes money saved by traveling less and time saved with fewer in-person appointments.
I really like that, still being able to connect, but also being able to have it convenient for us.
Time is money, gas money, time in my car. If I'm driving to a doctor's appointment or waiting in a waiting room, that's something that I'm not able to do something else or get other type of work done.
Providers are also exploring how telehealth can lower overall costs.
The healthcare industry is looking at ways to reduce cost of care, and video visits can be used to, again, be more preventative. A patient could, instead of going to the ER, try to get on a video visit with a provider.
But the Connected Nation Michigan study also found some concerns among patients about trying telehealth, including a fear that virtual visits would cost more than in-person appointments. But because of the pandemic, insurance companies are covering almost all telehealth visits, and providers are now looking at long-term use.
Telehealth will be used to reduce cost of care, improve quality, really be more proactive in treating the whole person.
2 out of 3 respondents also raised concerns about their privacy. Healthcare providers say they take protecting your data very seriously.
That's probably one of the most important things about telehealth, is the protection of the data and patient privacy.
In fact, the law requires it.
We are bound to the same, rigorous level of protecting their information as if they were stepping foot in a hospital, an emergency room.
We have to ensure that all data is encrypted, that health information is protected, and we are accountable for that.
Patients can also do their part by creating better passwords and keeping their devices up to date.
Almost all the time, those software updates include security fixes, and those are really important for protecting privacy.
Some respondents to the study also worried that health issues may be missed or misdiagnosed if they use telehealth. But things like remote monitoring devices are helping doctors keep better tabs on their patients.
At Munson Home Health, we use remote patient monitoring equipment, and we put those units in primarily with our high-risk patients. It's been really effective for these patients as far as being able to intervene early in their care.
I've been able to do a variety of different visits and address a lot of different things by doing telemedicine. It really is the same as me being in the office.
The benefit of that, too, will keep people from having to bounce back and forth between the hospital, especially in the rural areas.
In fact, in recent months, telehealth has become critical for many patients.
It's certainly been literally a lifesaver in the age of the pandemic right now.
Minimizing exposure decreases their risk, especially for our elderly or at-risk patient population.
and healthcare providers say they'll let you know when an in-person visit is a must.
There will never be a substitute to the real one-on-one interaction with a provider. That's a given.
One of the biggest challenges surrounding telehealth is internet access.
Since COVID hit, the demand on the internet is increased roughly 30% on the networks up here.
Despite that need, the Connected Nation Michigan study found only 10 Michigan counties were telehealth ready, even before the pandemic hit.
Some of the challenges with using telehealth, especially in the rural areas, is just the lack of broadband internet access or cell service.
One of those barriers is the technology itself and making that technology available to both hospitals, doctors, and to patients as well.
That means many patients and doctors do not have the internet access they need.
We see telehealth as being one of the major applications that's really driving the need for broadband connectivity in general.
We have the technology to do it, but you can't get it to the people because we don't have the bandwidth for it.
We need to work very closely with our hospital system and allow people the opportunity for telehealth, telemedicine.
Connected Nation Michigan and its parent company, Connected Nation, are working to find innovative solutions for expanding internet access to more people, no matter where they live.
We're working with local community leaders and the service providers to expand not only the access to it, but also the adoption and use of broadband.
It's work that's vitally important as communities and healthcare providers look to expand telehealth resources to all people.
I just think this is the future of healthcare, and you're only going to see it grow.
To get the facts about telehealth and learn more about the ways healthcare providers are leveraging the technology, head to connectednation.org/telehealth.